In Governor Kathy Hochul's budget proposal this year, there is a commitment to a statewide expansion of teen mental health first aid training, which is supposed to give young people the tools to respond to signs of mental health anguish in their peers. For more on what this would look like in practice and how it could be implemented broadly across New York, we're joined in the Capitol Press Room studio by Glenn Liebman, CEO of the Mental Health Association of New York State. So, for starters, can you elaborate on what teen mental health first aid looks like? And is this something that is being practiced or taught in parts of the state already?
Sure. So there are all kinds of components of mental health first aid. There's adult mental health first aid, there's youth mental health first aid, and there's teen mental health first aid. Teen mental health first aid is specifically for young people, for teenagers. Mm-hmm. Youth, it's not for the youth themselves, it's for people who train youth. So it's like teachers and people who run children's programs, things like that. They can teach youth mental health first aid. Now, teen mental health first aid is different. That's specifically, and that's why I think the governor loves it. It's a peer-to-peer model.
Right.
So they can actually have conversations with each other. They have a basic knowledge about mental health. They know who's a safe person they can talk to, what do they do in a crisis, and they can talk to each other. And I think that is really, that was one of the key points that the governor has been talking about for a while. To her credit, she recognizes that there's been a youth mental health crisis, and she sees the different tools that could be utilized to help respond to that. And teen mental health first aid, because of that peer-to-peer model, is really one of those essential pieces.
But what does it look like? Because when I think about first aid in the traditional sense, it's a hands-on thing. I see Glenn is choking. I come over and I perform the Heimlich maneuver, or someone has stopped breathing and I'm checking their airwaves. Is this something where if I see someone might be struggling, I go, hey, tell me a little bit about yourself and what the issues are, or do I then flag it for someone else? It seems like it's more about the latter and trying to identify how to help other people, not necessarily providing that help yourself.
Correct. There are situations where you can, again, we're not asking young people to be clinicians. There's no expectation
Take
of that
two
at all.
pills and see me in the morning.
Exactly.
I'd like to change your SSRI routine.
That's right. There we go. They can't prescribe yet, as far as I know. But no, it's really a model where teens, when they are talking to friends and identify that friend that maybe they're going through something, mm-hmm. they can talk to them as a fellow teenager, or they can recommend somebody, whether it's a school counselor, trusted adult, but somebody they could talk to, reach out to. That's really what it's about. It's essentially that they can have their conversation, but they can also do the piece where they can make sure that somebody, if they're really in crisis, can get somebody who can help them immediately. And there are subtle differences. There are obviously people who are suffering and need immediate support, and that's what this is about too. But there are also people who are sort of like struggling just in general, and they need help and support, and they need a trusted friend, somebody to work with them. And that's the teen mental health curriculum really addresses all those pieces, and that's, I think, why it's been very successful. It's not a New York model. This is across the country, and it's an evidence-based model. They're showing all kinds of successes around the country around doing this. Now, I will say that the governor, to her credit, has done what she's proposing is by far the largest expansion in the country. The whole notion of she wants to see every 10th grader trained in teen mental health first aid, that's phenomenal.
And is this training that would happen in a classroom setting
mm-hmm.
and would just be required to be folded into some sort of lesson plan? Or is this a simple, hey, make this available in some way, shape, or form and figure out a way to do this? Maybe it's after school,
sure.
Or maybe it's not even a mandate and just simply, hey, here is a big pot of money that's available if you decide to go down this route.
Right. So I would think that it would be very hard to mandate it, but I would think what they would do is what you were saying is that there will be funding available to an agency to offer to any school, any 10th grader in New York State who's interested in getting it. What it is it's 3 45-minute trainings. Generally, it happens during the school day. They could put aside about 45 minutes for somebody to come in and do the training for them. And a lot of times it's like a teacher or a counselor who works in the school. They can actually do the training. So it's 3 45-minute sessions. How they break it up is up to them. They could do it once, the first week, twice, however they want to do it. But that's how it's supposed to roll out.
Is a component of this the idea that you need to overcome some sort of stigma about, one, being comfortable identifying that, yes, I have this issue, thank you for asking me about it, or two, that someone feels comfortable enough to go up to someone and say, hey, it looks like you're struggling, and you need help? Because I have to imagine on both accounts, there are people who don't want to talk about it and people who don't want to ask about it.
Right. What's great about young people is, because we have a school program, another program where we go into schools and talk about mental health. What's great is that they're so different than my generation or your generation, where they basically are very open about their mental health issues. They're very open about talking about it. And, you talk to any counselor or teacher, and they'll tell you that they're very, very open about it. So I think this, in a way, is a really remarkable piece, because the idea of every 10th grader getting this training, the preventive aspect of this is, just imagine that somebody 5-10 years down the road is dealing with a mental health issue. They have the knowledge and the currency to know what to do with that. And it also, you talk about the stigma, it also gets rid of a lot of the stigma, because if every 10th grader in New York State has been doing this, then they're very comfortable talking about it. And it really normalizes mental health discussions, which already it's heading in that direction. I think this is the kind of push that will make it happen.
You and I are both young at heart, but we are by no means Gen Alpha. So how important is it that there are young people, those teenagers who this is designed to serve, actually taking part in coming up with the way this is crafted? Because you and I might have a completely different approach to broaching these issues and teaching about these issues than teenagers today.
Yep. Well, first of all, you're very generous to put you and I in the same category, because
why not?
A lot of age difference there. But no, it's definitely youth oriented. It's much more than just sort of like someone's going to talk to them 3 times for 45 minutes about this is what they should do, this is what they should do. No, it's much more about dialogue. It's much more, they have all kinds of exercises where young people are participating and feeling that they're front and center in any of these discussions.
What about once a kid might identify, yep, I need help, the first aid's been administered, is there reason to believe there will be services to connect to those kids? And so it's not just about identifying a problem and then leaving them hanging.
Again, the governor has like this 3-pronged approach that Commissioner Sullivan does, where there are now about 1,300 mental health clinics and schools across New York State. It's not going to the counselor anymore. You actually can go to a clinic if there's some serious issues. There are 1,300 of them going across the state, and there are more resources coming out for children's mental health programs. So we're certainly hopeful, whether it's in school or outside of school, that there are going to be a lot more of those providers who are going to be out there doing this.
So you don't feel like it's the case where we're going to be identifying problems and then not creating a pathway to addressing them?
Yeah, I mean, again, if problems are there, they should be identified. There's never enough providers, and obviously, we do all the workforce things and everything else under the sun fighting for that. But the reality is it's much better to identify it and figure out some kind of strategy to work with somebody down the road who will be responsive to their needs, rather than sitting there and just facing all kinds of, issues and then not talking about it or anything like that. Better be out there than staying in the silence.
And in terms of what this will mean for the status quo, how big of a change is the governor's investment here? Is this something where we're going to go from just a very small footprint in New York where schools are doing this? Or is this already a big part of the education experience in New York?
I don't want to oversell this, but I think it's monumental. I really do. I think that the idea of doing this, I think, is going to be something that is going to be something the entire country should be embracing, because they're going to look at New York and hopefully in the success that we've had in engaging these 10th graders, as I said earlier, who can now are now sort of the prophets, who are the mental health prophets, who will go out there and talk about this and make sure that people understand it and the stigma is erased and eradicated, because they completely understand mental health and they are willing to talk about it, and hopefully the next generation will be even more willing to talk about it. So we really think that there's something that is very exciting. And we're an incubator in New York, but I think that the rest of the country will notice it as well.
Well, we've been speaking with Glenn Liebman. He's the CEO of the Mental Health Association of New York State. Glenn, thanks for visiting us in the studio.
Always good to see you, Dave.
Support for Capital Press Room comes from National Fuel, working to help customers understand what drives energy bills, from taxes and state-mandated programs to market-driven price increases for natural gas, which utilities don't profit from. More information at betterplansnobands.com.
And by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.